Hello, my name's Shauna, and I have been studying Pakistan all semester, and we'll be discussing that today. So, Pakistan is located in southern Asia. It borders the Arabian Sea. It is surrounded by India to the east, Afghanistan and Iran are to the west, and then China is north of Pakistan. The land takes up 795 kilometers in size. It has about 25,000 square kilometers of water. There are three different regions within Pakistan: the highlands in the north, the Indus River Plain in the center and east, and then the Balochistan Plateau in the southwest. Pakistan is a very dry, desert, hot climate. It is an underdeveloped country. There's lots of political disputes. There's low foreign investment. It does have issues with terrorism still, which makes it have inadequate security. Shortage of electricity is also an issue. And then again, difficult investment opportunities for all those same reasons. It's not completely hopeless for Pakistan. There are efforts being made to improve the status, including this Chinese Pakistan economic corridor. China is giving $60 billion to energy and infrastructure boost that will hopefully bring in some more foreign investments and boost the economy in Pakistan. The government is a federal parliamentary republic. There's a president, Alvi, who was elected in 2018, and then a prime minister, Khan, that was also elected in 2018. The government also, has issues within itself, and then also again with the terrorist behavior in the country. They don't really have a lot of control over everything at all times. Their healthcare system, they do not invest a lot of money from the government. Only 0.8% of its GDP goes to healthcare. Despite that, their the health of the citizens has improved because there has been some effort put in. It's just not quite enough, and there's still a lot of room for improvement. They do have public and private facilities, but again, the out of pocket expense that the citizens pay is 76%. The medical staff is inadequately trained. I've talked about these lady health workers that the country has. It's government trained or sought out individuals that go around and do education within the community. They're used a lot in the rural settings. They go out and educate on vaccines and sometimes provide vaccinations, but these are not like nurses and doctors. These are citizens that are just kind of specifically trained, which is beneficial, but it's not quite the same. They're male paramedics. Only about 2% of them are actually trained to do the job. The rest of them are kind of volunteer people that just come in and do it without actually having the training in the field. And then there's traditional birth attendants that, again, are not nurses and doctors, but they are there and help assist the midwives, but, you know, not quite medically trained to do the job that they are probably doing. Reproductive health in Pakistan, again, inadequate access to facilities is going to be a common theme in the country. They lack contraception, the use of it. There's high fertility rates, especially in the rural areas. Women have an average of 4.2 children. And then there's a high maternal mortality rate. Pakistan has the third highest, maternal child and infant mortality rate. Their infant mortality rate, again, highest in the world. They have 671 babies that die within the first month of their life each day. There are 665 stillbirths daily, so their mortality rate is 46 deaths per 1,000 live births. The most common causes of neonatal death include prematurity, birth asphyxia, trauma, and sepsis. Some pediatric risk factors: malnutrition is a big one. There's a lack of clean water and food, basically. It says 1,100 Pakistani children die daily from diarrhea or other illnesses related to sanitation. So they have a lack of clean water, inadequate sanitation, and then the children are dying from malnutrition and diarrhea. Again, inadequate access to care. They die and suffer from diseases such as pneumonia, polio is huge in Pakistan. It's one of the last countries in the entire world that still suffer from polio. I talked about this in another um, class assignment, that there's such a debate about polio, and there's certain parts of the government or these other individuals that are anti-polio vaccines, and so these lady health workers have to go around and educate, and they just try to have to like kind of sneak it by some of those people and get these kids vaccinated. And then malaria and measles are another common disease that children suffer from. Social issues that the PEDS age group suffer from are lack of adequate education. Education has not always been mandatory in Pakistan. There was an amendment to the constitution that eventually made it a mandated situation, but it hasn't always been there, and so it still lacks um, that part for kids. Sexual exploitation, child trafficking, labor. They're often working younger instead of going to school. They're working. And then juvenile marriage is a big thing. Interventions that can be done to decrease the morbidity and mortality. Prevention of maternal sepsis is huge. That is a big factor in the maternal and infant mortality, is that the women are, giving birth in unclean, unsafe areas. So even just basic hand washing and providing a clean area for the birth to occur. Antibiotics are huge and not as available. And then the whole gamut of preconception to postpartum, there's just a lack of care. So a lack of adequate access to care. So these moms are not getting the prenatal treatment that they need, and are suffering from that. Vaccinations, again, are huge to get polio vaccinations and all the other ones. Doesn't always happen. And then antiretroviral therapy, if we can provide that. HIV is still an issue there too. So providing that is a good intervention. And then exclusive breastfeeding, that's big for the malnutrition. They're trying to encourage moms to exclusively breastfeed for 6 months and then hopefully continue on for maybe 2 years. And that will help with the little babies. Adolescent risk factors, low school attendance, again, a common theme. Juvenile marriage is huge. Illegal or unsafe work, again, there is terrorism that contributes to some of the society. Females have a major issue in this country because their rights are not as prevalent as the men. So they tend to use their body as an asset, which, will lead to this unintended fertility, then the maternal mortality, and then sexually transmitted diseases and HIV. And then they do have issues with alcohol and drugs like most other countries do, although Muslims have strict rules against alcohol, so they have to hide it even more. The indicators that I picked for Pakistan are the under 5 mortality rate, and then the mortality rate attributed to unsafe water, unsafe sanitation, and lack of hygiene. To me, these are just basic things. If you don't have safe, clean water and unsanitary conditions, how could you possibly be successful in anything else? And then again, focusing on these kids, these preventable things that are affecting the children in the country. If you can't do that, then you can't succeed in much of anything else. So all this preventative health care and providing clean water, I mean, those are essential to ever being better in the country at all. So those are the ones that I picked. In summary, Pakistan, there is still hope. They have a lot of room to grow. They need to make changes in their government. Their government needs to provide federal allocations to health, to education, to prevention, eliminate the terrorism within the country. Health needs to be considered a constitutional right, and it's currently not in the country, and so therefore they're not healthy. And then it is still viewed as a social good, which is never a good idea. So they need to change that and stop profiting and making people pay out of pocket, because, that is a huge reason why most of the community and citizens of Pakistan live in poverty, is because whatever healthcare they do have to receive, they're paying out of pocket. And so how can one ever get ahead with that? So, anyways, it's been very interesting learning about this country. It's obviously very opposite of the country that we live in. So, it's been pretty eye opening and life changing. So, thank you very much. Have a good day.